I'd like to call the Social Services Subcommittee to order. And, oh, just a minute, I gotta pull my agenda up here. Any disclosure of pecuniary interest in the general nature thereof? Seeing none, no delegation. And I'd like to make a motion that Kathy will chair the meeting today because I have a sore throat, right? So. Do I need a seconder?
I think you just need a mover and I'll move that.
Oh, you're going to move it? Okay.
Because you're chair until you hand it over. So I'll move that.
Okay, thank you. All in favor? Thanks, Kathy.
Okay, no problem, Bonnie. So now I'll take over. So we've done the disclosure of pecuniary interest. We had regrets from this meeting from Councillor Bunting, no delegations scheduled. And so item number 4 is report of the Director of Social Services. And item 4.1 is purchase of service agreement with the United Way Perth Huron. And this is really great. We've been waiting for this for a little bit of time. So I'm really happy to see this. So did somebody want to speak to this and explain it a little bit to us before we move to a motion?
Hi, Councillor Vasilakis. Yes, and today I brought some partners on the meeting with me today. So we have Ryan Erb from the United Way, and I see Joelle popping on. And then for the second report, I have Deb Wiseman from Huron Perth Healthcare Alliance and Chief Adair. So they're here to talk about the programming as well if questions arise. So the first one is the purchase of service agreement for the United Way. Historically, we have looked at this through the grants program, and we wanted to transition it out and bring it into a purchase of service agreement. So when we looked, did a review, it had typically been supporting the SRPC in different endeavors of the reports that they were looking at. When we looked at what the needs of our within the social services and with the new community safety and well-being plan being implemented, we designed a purchase of service that was going to be twofold with the United Way, I'm happy to say. So the first part of the purchase of service is where the SRP will use research guided by the community safety and well-being plan to do their research, projects based on from the community safety and well-being plan. So we will look at support reports that will help move this plan along and move towards the priorities that are outlined in the plan. So as we know, the community safety and well-being priorities include system planning and integration, adequate affordable housing and attainable housing, affordable and accessible health, social and recreation services, and social inclusion. So that's the first part of the purchase of service agreement that we're entering into. The second part is discussions Ryan and I have had in the past, where we know coming out of COVID, and we've seen in the past that many nonprofits may be struggling, especially around their board governance and board of directors. And this, they will provide a service that will help support the board of directors in nonprofits that we find struggling within the community. So that's what's speaking to this report.
Thank you. Are there any questions? I don't see any. We do have a staff recommendation that the report titled Purchase of Service Agreement with the United Way Perth Huron be received for information, and that the Director of Social Services and Chief Administrator Officer be authorized to enter into a purchase service agreement with the United Way Perth Huron. Moved by Councillor Burbach. Any other discussion? Councillor Burbach?
Just like to thank the United Way. I think this is an excellent partnership, and I'm excited to see it as it moves forward. I think everything's better when we work together.
Yeah, and I think that this has been going. This partnership and collaboration has been ongoing. I think this formalizes it, and it takes it out of that sort of community grant programs that would have to be reapplied every year. So I think it's a really good move to sort of codify the relationship a little more. So it's great. So with that, Councillor Henderson, go ahead.
I just wanted to say, and it's like a government program, we're removing the red tape, all the forms you have to fill out for a grant. Sorry. And thanks to
Thank you to everyone involved. Okay, so all in favor? Opposed, if any, and that's carried. Thank you, everyone. And then we have report of the Supervisor of Social Services, item number 5, and 5.1 is update on the Homeless Access to Care Program. And who would like to speak to this one?
I will speak to it, but I do have my fellow partners on the line, and Kelly Stone, I will refer to operational, Deborah Wiseman for the hospital part, and Chief Adair for the paramedic end. And I'm very excited to discuss this report. It is a partnership that evolved out of COVID that was long overdue, the strength in this partnership. So this is the silver lining for us. We have been able to build a team for our most vulnerable community members that address the issues that arise from a medical perspective and a housing perspective for those that are precariously housed and homeless. This team that we were able to have a contract with HPHA where they employ a part-time nurse practitioner and a pharmacist. We've linked that with our outreach team, and then with the Perth County paramedics, a community paramedic team. And that is actually full-time, the paramedic and the nurse practitioner and pharmacist as part-time. I'm going to just give a high overview of a couple of the outcomes I've seen, and then Kelly can get into some of the operations, and I'll let Deborah and Mike speak on that behalf too. So a couple of the key outcomes, as me and many years of social services have seen that I was thrilled with, is basically we were able to set up vaccine clinics within social services department to help those who get vaccinated that were not using our typical vaccine clinics. It provided a safe, secure place, a trusting place for them. Along with the vaccine clinics that the paramedics did, we have had the nurse practitioner and the pharmacist be able to work within our office too to see clients. And I'll let Kelly speak to some of the operations of how many clients that weren't necessarily rostered are now rostered, or at least in receipt of ongoing health care. And I'll pass it on to Kelly right now.
Thanks, Kim. So through the chair, what we've seen is since this program began, we've been able to register over 40 individuals with ongoing primary care through the nurse practitioner. We've also seen that the nurse practitioner has facilitated rostering over 100 individuals with a family physician. And that means either as a new referral or a reconnection to a previous healthcare provider that for whatever reason they became disconnected and were discontinued from that healthcare provider. So she was able to reestablish connections there. We've also seen 20 individuals supported through pharmacists with medication management. Some things that we have seen with our outreach team are some connections with either individuals who are experiencing homelessness or who are housed within our community housing buildings, but we're lacking some ongoing care. We saw one individual be supported with a facilitation to long-term care who was determined unable to live independently anymore. And we have our outreach team going out as needed throughout the week with both the paramedics and the nurse practitioner. And we also have a drop-in clinic that is run every Friday at the local. Some of those are done by appointments and some of them are drop-in specific. A number of our referrals are coming through either outreach or through OW caseworkers, or through other community providers who are aware of the program and believe that a connection would be beneficial to the client.
Thank you. So we're hoping to extend this program and continue it into the 20, as we've used COVID funding for this, but we're hoping to look for extension of this program for 2022. As I said, we are addressing some of the gaps that we were seeing in service delivery, whether it's a move from Ontario Works onto ODSP, the nurse practitioner can help facilitate those forms. Paramedics, as COVID, as some of the restrictions released, we're hoping to put this team also in our community housing buildings within the community lounges and continue the services. So I'll let, sorry, through the chair, would you like Deb and Mike to speak or answer questions?
If Deb, Mike, if you'd like to say a couple words about the program and how you view it from your perspective and how it's going in the collaboration, that would be great. And then we'll open it up to questions. Go ahead.
Thank you, Chair. So I'm Deborah Wiseman. I'm the VP of Partnerships and Chief Nursing Executive for HPHA. We just want to send a gratitude and level of thanks to the council members for this program that started out as a pilot and has been continued onwards. It really does afford an opportunity for those most vulnerable in our community to have access to primary care. And while it seems quite simple to those of us that have easy access to primary care, for these vulnerable populations, it's difficult for them to mobilize. They don't feel comfortable coming into our emerge departments either. And so often they choose and elect not to have any care whatsoever. So offering them the opportunity in places that they're most comfortable, that they feel safest, in a combined effort with individuals that they have linkage to or become linked to is an incredibly important initiative. We're seeing really good outcomes, not just the paper outcomes of numbers and rostering and other, but just the theme of safety that this program creates, the theme of health that this program creates, and certainly a collaborative effort across several sectors to make this work happen and to unfold this in our community. So very thankful for this generous partnership, and I'll turn it over to Chief Adair for further words. If you have any questions, let us know.
Hi, sorry, I had a visitor stop in behind me. It distracted me. No, you know, I would certainly echo some of that, the sentiment about the partnerships. I know that before I was paramedic chief here, I went to the MTO one day to renew a license, and I was actually a paramedic deputy chief in Waterloo at the time, and found out I needed a physical. And at the time, I didn't have a primary care physician. I was in a phase of transition. It was because I was new to that role, and this is going back a few years. And to my surprise, you know, in Perth County and certainly in Stratford, there was no walk-in clinics. And so, you know, it was easy for me to solve that problem and that issue, and just simply just drive back to the Waterloo region and figure out a solution to that issue. But for those that are, you know, for those that don't have those resources and means, this is exactly what this program can do. And that was just to do a physical, but this is really about the real deal providing healthcare. So I know that from feedback I received directly from paramedics and from the system, that we've made a very significant difference in people's lives that are not accessing healthcare in the way that that's available to them in our community. And right from vaccines to working with persons who don't have primary care physicians. We've even identified, I know that we've even taken in clients and patients in our mobile integrated health program that don't meet the criteria of this program. So it's even been resulting in some self-referrals. And the difference is there is that we can work with persons to either find physicians, or if they aren't connected with a physician, we can certainly work with our NPs. We can work with the hospital. We can make sure that people are getting the care that they need and help them to navigate the system, but also provide medical care and those sorts of things. So we are very grateful for the funding that Stratford has provided with respect to this program. And certainly, you know, moving into next year, there's going to be some great announcements and news that come down in the very near future. I know that it is public knowledge that the Ministry in Long-Term Care just announced $5 million of funding for community paramedicine in Perth County. So it's very new. That was on Friday, and our warden is aware of that, but we have a lot of work and mobilization to do, maybe with this team even in the very near future. So those are some of the things that are going on and some of the things that are going on in my head, but certainly open to any kind of questions that you may have.
Thank you for that. I didn't have a question, but more at sort of the theme around meeting people where they are. And when you have vulnerable citizens, whether they're vulnerable because they're precariously housed or homeless, or whether they're struggling with additional issues, meeting them where they are sort of physically and emotionally and where they feel safest. And you can start that conversation with, just basic healthcare or primary care, but then having all of the other supports there with housing or social services and all that in one place. I think you build relationships that maybe can, you inch people in a direction when they're ready and when you're willing to go to them where they feel safest. So I was really pleased reading this report, because if anyone spends any time on social media, you'll see how in the public they'll think that if they see someone who's homeless or sleeping rough, they'll assume that those people aren't getting additional services or they don't have access to things. And it's these kinds of programs that I think we do need the public to know are there and are helping. So thank you. Any other comments or questions from? Don't see any. Councillor Burbeck?
Thank you. Yeah, again, this is a great program, and I guess COVID was the catalyst for it, but also the implications or the impacts of COVID are ongoing, and we see that in our community. It's quite visible. So I think it's quite reassuring to know that we have this team in place and that we'll be able to be dealing with the ongoing issues, because just because the virus is being contained doesn't mean that the impacts aren't still being felt by our vulnerable citizens. So I think this is a really great program, and it's reassuring that it's going to continue.
So we do have a staff recommendation that the report titled Update on the Homeless Access to Care Program be received for information. Moved by Councillor Henderson. All in favor? Opposed, if any, and that's carried. And that's great. So our next subcommittee meeting will be in January. Our December meetings have been canceled, not necessarily because of Christmas, but because of a whole whack of budget meetings that we have to fit in there somewhere. So now the only thing left is a motion to adjourn. Moved by Councillor Burbeck. All in favor? Have a nice afternoon, everyone. Bye now.